Everyone, my name is Rina De La Cruz, your student nurse for today. So today I'm going to perform administering oral medication. So the purpose of this procedure is to provide medication that has systemic effects in gastrointestinal tract. So the first step is perform hand hygiene and observe the appropriate infection control procedure. This is to prevent the spread of microorganisms. Wear glove or PPEs if necessary. The next is unlock the dispensing system. The rationale for this is to get the necessity for medication. Next is read the medication order and take the appropriate medication on the shelf, drawer, or in the refrigerator. The rationale for this is reading the medication order will let you know that what medicine you take are correct. Next is compare the label of medication container against the written order. This is to assure that you get the correct medication. Next is check the expiration date of the medication. By checking the expiration date of medication, you ensure the safety and to prevent administering expired medication. Next is prepare the correct amount of medication for the required dose. The rationale for this is preparing the right amount dose will prevent the patient from having overdose, making them sure not to contaminate in order to prevent the patient get microorganism from you. So preparing tablets or capsule. Place a package, unit dose capsule or a tablet directly into the medicine cup. Do not remove the medication from the package until at bedside. Do not handle the rationale for this is do not handle pills or capsule by hand in order to prevent the contamination of the medicine. Next, if using a stock container, pour a required number into bottle cup and then transfer the medication to the disposable cup without touching the tablet. The rationale for this is pouring it into the bottle of cup. The disposable cup will make sure that it can prevent contamination and to let the patient swallow the medicine his or her own. Next is, if the client has difficulty swallowing, crush the tablets to fine powder with a pill crusher. The rationale for this is, crushing the tablets will help the patient swallow the medicine easily. The patient can swallow the medicine. Next is liquid medication. So the first step is thoroughly mix the medication before pouring it to the cup. The rationale for this is some medication requires uh, shaking well before pouring it, or some require should be shaking it well. Next is remove the cup and place it upside down on the countertop. The rationale for this is placing it upside down will prevent cross-contamination to the cup. Next is hold the bottle so that the label is next to your palm. Pour the medication away from the label. The rationale for this is having the label next to your palm ensures that it is the correct medication. Next is place the medication cup on a flat surface eye level and fill it to the desired level using the bottom of the meniscus to align with the container scale. The rationale for this is filling it on an eye level ensures that the accurate measurement. Next is before capping the bottle, wipe the lip of the patient with a paper towel. The rationale for this is to prevent the medication build up on rim and cup. Make sure the paper towel is clean. Next is keep the unit dose liquid in their packages and open them at the bedside. The rationale for this is keeping the unit dose liquid packages prevents any microorganism from entering. So let's proceed. For sublingual medication. First is instruct the client to place medication under the tongue and allow it to dissolve completely. The rationale for this is instructing the client will let her or him know what to do. Tayo sa iyong model na ito. Ang pinag-dissolve sila.
Habil o tato?
Ha?
Habil o
Hindi. Tunggal mo. Okay na? Okay. Next is for vocal administration. First is instruct the client to place the medication on the mouth against the vocal cheek until it dissolves completely. The rationale for this is instructing the client will let him or her know what to do. Butang sa kilid ha, diri ba sa vocal diri. Until mag-dissolve. Butang. Ayun. Ayun ko pa. Dissolve na. Saan na? So next for nasogastric tube or NGT administration. So for NGT administration, you need to crush the tablet or open the capsule and dissolve the powder with 20 to 30 ml of warm water in a cup. Crushing the rationale for this is crushing the tablet will help the medicine get into the NGT or the nasogastric tube. Next is record the medication given, dosage, time, and complaints or assessments of the clients and your signatures. The rationale for this is all the document must be done on time that the medication is administered in order for the doctor to follow up with the next order. Then dispose all the supplies appropriately and wash your hands. The rationale for this is doing aftercare while you've done your medication given.